Thank you so much. Our last session for today is going to be about physician health and wellness. I would like to introduce Dr. Rebecca Margolis. She practices pediatric anesthesia at the Children's Hospital of Los Angeles. She's an assistant professor of clinical anesthesiology and the inaugural director of well-being in the Department of Anesthesiology and Critical Care Medicine. She is the founder and co-chair of the Society of Pediatric Anesthesia's Committee on Physician Well-Being, where she aims to create systems approaches to reduce burnout and foster healthcare provider well-being. Today, she will be talking to us about well-being, the beating heart of organizational change. Please help me welcome Dr. Margolis.
Thank you, love. Hi, everybody. Can you turn my lavalier mic on? Thank you. Good. Oh, amazing. Hi. Thank you for having me. This is by far my favorite meeting, and I'm just honored to be here. So I am the Crawford Miles Esterline Lecturer, and very grateful to receive this honor. And I was nominated by Dr. Geller. It was really touched me. And to be honest, I got this email on like a horrible day last week where we had a bad clinical outcome. So thank you for brightening my day. To tell you, Dr. Esterline's history with our society is rich. Dr. Esterline actually helped founded the AOCA, served as president and treasurer of our society, and also was one of the first fellows of the AOCA. And in 1973, Dr. Esterline was awarded a Distinguished Service Award. And so we honor Dr. Esterline's legacy to teach and foster our own society. So thank you very much. Today I'm going to talk to you about well-being, the beating heart of organizational change. And I have no actual disclosures, but I want to frame what my real disclosures are. This is not a lecture where I'm going to tell you that you should do resilience module. I mean, let's be real, you're sitting in the last lecture of a very long meeting. So you do not need any help with resilience. What I'm going to talk to you about are not personal resilience, not yoga, not breathing. These are all important things, but I'm going to table that, and I think we're going to discuss some of those personal habits in our next lecture. What I'm going to talk about is the fact that we have a systems issue, and we need systems level change, because I don't know if you've noticed, but everyone at this conference is talking about how we're short in medicine. So if for no other reason than we have to figure it out, or we're going to have nobody less to take care of us, that is why this issue, I'm actually excited that this issue that I've been caring about for years is finally getting attention, because no one's left in the OR. So what we're going to talk about today is what you probably viscerally know, what actually drives your own burnout, but I'm going to frame it for you. Talk about how I think about well-being initiatives. And to be honest, I'm like extremely pragmatic, and part of what I like about AOCA is that you come to these lectures and I kind of leave with clinical pearls. So this lecture is going to have this much literature and then like a takeout menu of things that I've tried that have worked. So that is the idea. Take something home. It's not everyone is going to fit you. And then we're going to talk about what kind of systems level interventions have I tried and that I'm keep trying. So what are your drivers? At number one on the top is workload and job demands. And this is that constant, please do more with less. I don't know if anyone feels that at work, but change your circuit, bring your pre-op nurse, can you put in your orders, discharge a patient, do everyone's job all at once. Control and flexibility, which is important, and I heard Mary Dale Peterson talking about if we don't, there's a generational gap, right? And I see it in this room, and I see it in my own group, and I'm sort of in that split, right? I trained in the old school way, but I think if we don't change, we're going to have less and less people coming into our specialty, so whether we like it or not, taxis no longer exist, and we got to get on Uber, so let's figure it out. Work-life integration, social support and community at work. This we all felt, I think, during COVID, when we're all on Zoom and we're losing, even in my own group, we're kind of losing the collegiality that happens with coming to meetings. And like, how nice was it to actually be in person? So this is very important. Organizational culture and values. And this means, do your own values align with your group, align with your hospital, align with your organization? Are they the same? Because that is like moral distress, right? Efficiency and resources, that's been, I think, everyone's bane of everyone's existence. I didn't know we had a protamine shortage till today. Thankfully, I don't do cardiac. And then this all centers around the middle, which is your meaning in work. Interestingly, the research tells us that if you spend 20% of your time doing what you find is meaningful, whatever that is. For me, it may be teaching, it may be doing research on well-being. You can, like the other 80% of the time, put me in the GI room and I'll actually not burn out. But that's what the literature tells us, 20%. So if you run a group or in any way you can find a way to get your 20%, you're less likely to leave medicine. So what does the research tell us? Amy Vinson out of Boston Children's, good colleague and friend of mine, did this ASA survey, went out, funny enough, in May 2020, a week before the pandemic. So they got a low response rate because they were not allowed to send any reminders, but they published some interesting results. 59% of our colleagues are at high risk for burnout. I think that's probably not surprising. It's hard to imagine that in 3 years this has gotten better. But what I love about this study is there's one thing I took away. Ask your friends, how supported do you feel at work? There is one question you can ask, and we're going to validate this question externally. We're working on a project together. For how supported on a scale of 1 to 5 do you feel in your work life? That has an odds ratio of 10 for burnout, 10. I mean, I'm no statistician. The number needed to treat, I understood when Dr. Viscusi said 2.5 was important. This is like my level, but 10 is enormous. So, and if you look at, do people feel supported at home? The odds ratio was 2. So we need to look at, are we supporting people at work? Because that is what's causing them to leave. What about COVID? I did this study on pediatric anesthesiologists because I saw my elder colleagues getting scared for their own health, people retiring, people feeling really isolated. We had a near suicide in our group. And what I found in this survey, so I sent a survey to the Society for Pediatric Anesthesia in May of 2020, and we found that COVID disproportionately affected women and underrepresented minorities, and this may be because of multiple factors, most likely the extra home responsibilities and elder care responsibilities. We found enormous changes in job satisfaction with lower job satisfaction and social isolation. The worst thing I found in this study was 25% of respondents said that they did not have somebody at work they could confide in. It's like so sad, right? I was writing this paper and I'm just like sad about that. You know, think about that, and that's what COVID has done. This had enormous effect on our money, right? Like what's happening in the market, our home responsibilities, whether we're going to retire or not. 11% of pediatric anesthesiologists said they plan to actually leave the workforce sooner than they thought, and all of these affected women more than men. So I'm in the middle of repeating this. Anyway, why should you care? Well, at the end of the day, I think we have to care because we're not going to have anybody left. But if you run a hospital, why should you care? Because it actually affects patient quality and safety of the care that we deliver. We have shown that physicians who are burned out or teams that are burned out much more likely to perform medical errors. Anesthesia residents who were burned out, less likely to check medication vials, order post-op chest x-rays, do a machine check. I mean, it's like terrifying. So obviously, trickle-down effects. We're more likely to get sued for malpractice. ICU teams with higher rates of burnout have higher rates of healthcare-associated infections and even mortality, and decreased quality of teamwork. In addition, it's really expensive, right? How many conversations have I had in the last 4 days about how much people are paying for locums, right? We're kind of expensive. And when we leave, we're even more expensive. For every physician, there's a calculator on the American Medical Association. You can actually calculate what is your rate of burnout in your group, and what does that actually cost your group. In our group, it was costing about $700,000 a year. So I went to my chair with that and said, well, here's why I want you to pay for some of these things that are not that expensive. And I think that the healthcare system is starting to realize just how expensive attrition is. Anyone know who this is? Well, I don't know who that is. But I think this is Hans Brinker, who held his finger in a dam to save Holland. Guys, this has been us the last 3 years. Like, no N95s, I'll bake it in my home oven. I'm looking at Twitter to figure out one number of degrees. I'm not kidding, this happened. We had a text thread among our attendings about how we should bake our N95s at home. I mean, we have been keeping our finger in the dam, and now it's starting to, where water's coming around, and it's coming around our feet, and we all know it. So this is why I'm here. This is why I think it's important, and we have to figure it out. So what can we do? I see well-being, there's 3 levels of commitment. There's the individual, which I think is incredibly important. I think if you don't have that, you can't think about the other things. But well-being has been weaponized against us as physicians, just like sometimes these reporting systems, right? It is not a you problem. These are good things, but I'm going to concentrate on the organization. What can you do in your organization? And then as a society, what are we going to do? Do we think, how should we treat doctors? What are our expectations? So I'm very practical. I like to think of this as, okay, what are like the buckets that what are the categories? I like things in a bento box. So 6 areas of work life. These 6 areas came from Christina Maslach. I'm sure at some point you've gotten some terribly annoying survey to see how burned out you are, and then we don't do much about the survey results, and then we send you another survey and a reminder that you didn't do it. But Christina Maslach actually created the Maslach Burnout Inventory, which is what most people use when they survey burnout. And it is from her work that I got these 6 areas of work life. And they really focus on, so workload. Is there sustainable recovery? I've heard a lot of discussion about that in last couple of days. Control, how much choice, how much flexibility do you have on what you do in the OR, what cases you get? Reward, most people think of money, but actually that is a small part of it, and we know that it's kind of a diminishing carrot of returns. If you look at some of the economic psychology, money matters, but being appreciated probably matters more. And so how do you feel appreciated by those in your hospital, in your group? Do you just feel like a cog in the wheel, that if the cog doesn't come, they're not going to really notice unless it's a little squeaky? Your community, do you have a supportive work community? Do people come help you? Do you feel like if something happens at home that anyone cares at work? Fairness, now this has to do with, how about just basic respect from surgeons, fairness, and diversity, equity, inclusion in our workforces? And then our values. Do we feel our work is meaningful, or are we rearranging deck chairs in the Titanic, right? So I focused, when I started, I kind of focused on 3 areas of success that I thought were kind of like low-hanging fruit. Again, I'm a pragmatist. So looking at community, how can we build a supportive community? How do you do that in COVID? How do you also create a culture of appreciation? And how do you give physicians a little bit of choice and flexibility? So here comes the diner menu of things, and then I'm going to end by talking about a project that kind of incorporates all of those areas of work life that I'm still working on. So our Surgeon General, he started under Obama, is back under Biden. I met him. He's a great guy. I met him at the 2016 meeting on American Conference on Physician Health, probably one of the best meetings I've ever been to. And he got up there. He was actually, it was Trump had taken over, so he wasn't in the White House. But he said, you know, I start all of my White House meetings. I didn't know anybody. And how do you build community in the White House? It's, you know, not exactly like the environment we have here. And he started every meeting by featuring one person, asking them before and saying, can you just start the meeting with 3 things I don't know about you? And can you just do that? And he said it created so much conversation outside of these boardrooms, basically, that people really got to know each other rather quickly. And I heard that idea, and I was like, oh, I have to do that at our work. I've been working with people for 8 years, and I have no idea some of the boxes outside of work, right? So we started doing this at our faculty meetings, and every time we have a new faculty member, we do it, and it was kind of fascinating. I left it up to people, you know, you can give a PowerPoint, you can just say the things, and we learned all sorts of fun things about each other. I think we need to, there's also, you know, everyone's like, oh, have cocktail hours. Do you want to spend any more time at work? I just want to go home. I think most of us just have so much to do, we want to go home. So how do you create more connection in the time you're already there, rather than asking people to spend more time? There's totally a place for cocktail hour, don't get me wrong. But in general, think about intentional meetings and increase the quality of time that you're already there. This is Mayo Clinic. That is my friend Sarah. She's an adult cardiac anesthesiologist at the Mayo Clinic, where she was telling me about this idea because she met her best friend in what she told me was a physician engagement group. In the Mayo Clinic, where Tate Shanafelt and a lot of these well-being gurus started, did one of the first studies on this, and they actually spend $25 per person and say, you can go to a restaurant and we'll put together 6 or 8 of you from different specialties, just sign up and we'll put you together, we'll sponsor a little amount of money, and you just have to go for an hour and you commit to like 4 of these a year. And interestingly, so she met her best friend there, which is how I learned about these. They ask you, they'll put on a website, they have a website of all the questions, and it's supposed to just frame the discussion. You end up talking about whatever you want, but one of the questions was like, how could you increase engagement in work unit? So they're trying to get real dialogue. They showed measurably lower burnout, social isolation, and higher well-being and job satisfaction. And this program is actually still going at Mayo and very successful. And then there's this, right? This is our job. I work in peds, and I've had to do this. The last time I had to do this, it was a child whose grandmother was babysitting and gave the child a water chestnut, and the kid choked on a water chestnut, and we went for organ procurement. How can you survive without a supportive community when this is what we do? I don't care if it's peds, if it's adults. What we do is almost unimaginable when you talk to people outside of medicine. And yes, we are trained to do this and we are trained to go on, but our job is a privilege and an honor, but it comes with a really hard emotional toll. And I think medical culture is built on this arrogance and this hubris that we're superhuman, right? We should just go on, and we are not, and nor do we even desire. Do I want the person who takes my child for an organ procurement to not have any emotion? I mean, I don't think that's what we want in our healthcare providers. So, how can we support each other? Survey of the ASA, we talked a little bit about this at the PBLD this morning. Basically, if you're in anesthesia long enough and you're playing Russian roulette every day, you're going to lose at some point. We're all going to have probably a perioperative catastrophe. Over 85% of us are going to. And what happens afterwards is most people, 88% of people said, I need time to recover. 19% of people said they never recovered. And then 12% thought about changing their career. After like all of the debt and the time, they were like, one bad perioperative catastrophe, I'm out. I mean, we have to think about this. And then you got to think about the patients in the room, because 2/3 of providers said, my care was impaired in the next 4 hours, but 7% of people were given time off. We have a cultural problem because we put the onus to say, I need a break on the person in the room who doesn't want to say, can you just cover my case because, you know, my patient just crumped and I'm like falling apart here. We need to have a system where, you know, we take a break from the OR, or we have to imbibe this in our culture that it's not normal that the whole team just go on. And I don't just mean us, I mean everybody in the room. Because yes, you do need to have a debrief, but we need to have a place where this is okay and where we can have peer support. Peer support is one of the most effective, and we could have a whole talk on peer support, many places do. I'm gonna give you one slide on peer support. Peer support is where somebody in your circumstance offers you non-judgmental support in a moment of distress. This is not, oh my God, I shouldn't have given Ansef because they had a documented penicillin allergy and they had anaphylaxis. We don't want to dissect the case. This is really hard. We work in a minefield. I had something, let me listen, let me hear. This has actually been shown in anesthesiology residents to be the most effective thing to make people keep going and enjoy their field. So it's really simple. I'm happy to give people, we have a whole 24-hour on-call team at our hospital. I know the real world. I'm looking at you guys. I know you practice in places that probably don't have this, but you can also be this for other people. Okay, what about our culture? Like how many IVs have you started on your colleagues? I mean, we don't have to disclose that because, you know, whatever, but we come to work, we're like sipping Dayquil, and COVID was the first time that people were like, ooh, I have a fever, I shouldn't come to work, right? Because I don't want to get somebody else sick, not because, oh, possibly I shouldn't be febrile and taking care of neutropenic patients, right? That's my world. So I think in our culture we have to think about what is the model, if you're an elder in the group, what is the model that you make for other people when you come to work, clearly you got the flu, you're still there. But there's a balance, I know, and I know some of you are thinking about the younger generation, had a hangnail and they couldn't come to work. But there is a line in the sand, and we need to think about that and also be okay without calling out sick. I'm the well-being director. I called out sick for the first time a couple of years ago, like profusely febrile, and still was like, oh my God, I feel terrible, but I was like, I have to do this. My husband's like, you're the well-being director. You can't go to work sick, but I still feel it, right? Another simple thing, people move to your town. Do you know who the doctors are? Do you even see a doctor? Do you go to the dentist? We actually mandate in the ACGME that our trainees see doctors. It's actually in their rules. We don't mandate that for us, right? So I very simply put together who are the providers in the area. I didn't say who recommended whom, so no one could get mad, right? But who's the dermatologist you want to go to? Who's the dentist? Who's the immunologist? Whatever. And just put it on our intranet so that it wasn't such a hard step. And I send it out every year during open enrollment. Social recognition. I noticed that the nurses in our hospital were really good at this. Like every banner in the hospital was the Daisy Award for this or the Great Catch. And I never saw any physicians on there. And I was like, I think it's because we don't take time to fill these things out, right? It's kind of like the eye reports at my hospital or whatever, like most of them are not done by physicians. So I thought, how can I make this better and why should we? Happier employees are those that get recognized at work. I know we think we're above all this, we are not. If you get recognized by your direct boss, you're gonna be a better employee, you're gonna stay longer, you're gonna call out from work less, and you're gonna have more energy. So how can we make people feel recognized? I went to Amazon, and I bought these boxes, and I hung them around our OR space and our ICUs, and I have these little cards. I call them a lifesaver program. We actually staple lifesavers to you have to have catchy names, right? I staple lifesavers to the cards, and we have now an online version of these. So you can fill them out. You can fill them out online. I gave everyone the promise of, you fill them out for anybody who has walked into this hospital, and I will figure out who they are, and more importantly, who is their direct boss. These cards actually get scanned into faculty files, employee files, and then added to, for our nurses, they get added to their pads for promotion. And then they go to their direct boss, and their direct boss has to distribute it. And I send kind of a template email to their boss, like, hey, your employee, you've probably never met me, right? I'm an anesthesiologist, I don't leave the OR. But your MRI tech was so spectacular, here's the thing they got. And they're so excited that they actually get to give positive feedback to people. So this has become actually something that we do in our faculty meetings now. We intersperse all of the boring on-start times and whatever with peer-to-peer recognitions. And it's become a little bit of our culture of now people will be like, oh, did you fill out a lifesaver for that? And I love when I hear that. So this is honestly easy and cheap. But now I want to talk about how do you bring all of these areas of work life together and really make the environment a little bit better and push the envelope. So how can we empower ourselves, the providers, to be the architects of our own environment? Because honestly, every day I feel like a carpenter and not an architect, right? We know a lot of the solutions that could make our daily work environment better, but there's this increasing divide between the administration and us, because we can't leave the OR. We don't have a forum to say, do you know that when you changed it to a 16-character password, I have to do that 50 times a day? Do you know that you're now paying me how much to enter passwords every day? It's all of these little paper cuts every day, death by 1,000 paper cuts, that I wanted to try and give people a forum to have some control. So this falls under the control. So I started what I call the Pebbles Project, which comes from the Muhammad Ali quote, "It isn't the mountain ahead to climb that wears you down, it's the pebble in your shoe." And this started, it was one night, I was on call and I had just finished a polytrauma, 2-year-old massive transfusion, save this kid's life, right? I'm feeling really good about myself, exhausted. I go back to my call room because what is there an open fracture in an hour that they want to start, right? And so I go back, I'm like, oh God, seriously, we just did MTP in a 2-year-old, can I just go to bed? No. So I go back to the call room and I go to lie down and there's hair from somebody else on the pillow, right? And the tube station is just going right outside the call room. And I'm just sitting there I just saved a child's life. And absolutely nobody cares if where I am, if I get any rest, or that I've been here for 24 hours, right? So that's where this comes from. So I really want to enhance your experience at the hospital mostly in professional conditions, but also personal conditions that maximize your well-being. So what we did is I sent an email to our group and I said, hey, here's a pebble. Here's an example of a pebble, because now everyone talks about it like, is this a rock or a pebble or a boulder? We have a whole rock continuum now, but I sent an email and I said, hey, I was in ambulatory surgery and there's 3 docs running the ambulatory surgery center, and there's 2 computers. And then so I went to another computer because I'm getting sign out the patients, you know how this goes, right? And there's a sign that says for translator use only. So I go to the next computer and it says for charge nurse only. And I like blew a gasket. And so my first pebble was getting another computer in the ambulatory surgery center. So I sent this example out and I said, hey, this is an example of a pebble. Why don't you come to a group? And this started during COVID, so we did it on Zoom. I'm excited to do them in person, but we did it on Zoom. And I said, come to a group. Your only commitment is like 45 minutes, and basically I'll be the complaint department. I am not promising to fix anything, but I want to hear what your complaints are, and my promise is that no leadership will be there. So no leadership will be there. We will all talk about them as a group. We may just decide as a group to solve one of these, or I may say, it's my responsibility to say, you know what? This is not a pebble. This is a leadership issue that needs escalation, and I'm going to be the messenger that does it in a psychologically safe way, this is my project, so the administration knows I'm bringing this. It's like a don't shoot the messenger, right? But I'll be the messenger. One of those actual pebbles that no one wanted to ask our OR director about was relief order. It was like a big thorn in people's side, and it just took like writing down in his mind who actually should leave first and putting it on the board. But this was like in everybody's mind. No one wants to talk about it because you don't want to tell your boss that you want to go home, right? But we all want to go home. So basically, I got everyone together. I brought one of our administrative partners, and what I learned over the years of doing this is that actually having somebody from IT is really helpful, because a lot of the issues have to do with infrastructure and IT. I now have bought the facilities department more lunches than I want my department chair to know, because facilities turns out to be a lot of what people's complaints are. And then I have accountability for completion and sort of communication back to, hey, Dana, you brought me this pebble. It's not a pebble. I went to the hospital. Well, actually, one of the complaints was they didn't have enough meeting space during COVID to have educational lectures for whatever reason. And I went to the hospital people and figured out it was like a giant boulder mountain, and it couldn't be moved. But I brought that back and explained why. And sometimes you just need a little bit of explanation, not just like the administration hates me. So that was the idea behind this. And we've seen all sorts of things. Scheduling predictability, that was a big complaint during COVID because people's kids were on Zoom, and no one could get them on Zoom because we're all starting the OR, but like some of us had one room. And I remember Karen being like trying to get her kids on Zoom. So we started a afternoon swing shift. It's like the sweeper shift. You come in at noon and you kind of stay till you clean things up, and you usually get the ICU add-ons, but it's good. And we do it for a week at a time. And it was so popular that now we have 2 of these shifts. And that helped, scheduling predictability. IT upgrades were huge. We got everybody web cameras, little things like badge readers. We didn't have badge readers in our OR space. For some reason, I didn't even know about them because like I don't go to the ICU. And somebody was like, can we just get badge readers so we don't have to enter our 17-character password 50 times a day? I was like, so it turns out that's actually took like 3 months, some money, but it got done. These are the types of things. Right now I'm trying to get, only anesthesiologists will understand how ridiculous this is. We obviously do pediatric cardiac, a ton of high acuity pediatric cardiac. There's no badge reader far enough away from the entrance to the CTICU that you have to stop with the baby kid on ECMO, go to the badge reader, stop the whole bandwagon. So my current 4-month and counting project is to get a badge reader outside of the CTICU. It's just funny, these things that like, there's a gap, right, between what you need and and having any time to actually escalate this stuff. We did some office and common space upgrades. I'll show you an example of some low-hanging fruit. Onboarding. We onboard new people, and they like get here, and we sort of toss them a pager and a call schedule and a locker. on your way. It really does not make people feel welcome. We spent so much time on the recruitment process and so little on intentional onboarding that one of my colleagues and I kind of sat down with the admin team and were like, okay, we actually have to make like a real onboarding day. They can't, and we had to have a cultural change of the day they start is not the day they start clinically. As a matter of fact, they need a week to get onboarded and really feel welcome and have them understand sort of the inner workings of like, well, who submits receipts and who does all this stuff and like, how do you get your healthcare? So that's been a big improvement. And then we have so many different attendings, and you guys may have this because I've heard a lot of shift. The PACU nurses didn't really know who we are between the mask and the hat and I get confused for the other young white girl in my group all of the time. We were co-fellows together. It's a joke now. She'll sign my patients out. I'll sign hers out. So we actually just took pictures of the attendings, and we have a photographer at Academic Place. So they actually have a photographer, because it's Los Angeles, that comes once a month and takes these professional headshots, right? But she comes at 9 a.m. Very helpful. My hair's in a bonnet by then. So we had her come, we convinced her to come at 6:30 in the a.m. Everyone can get their pictures. And just little things like that. I'm trying to get the nurses actually to do this too, because I have the same problem. I don't know who half the nurses are anymore. Relief order, I talked about this. Hiring process changes. I think this comes a little bit, we have a diversity, equity, inclusion officer now in our department who's helping us with some of this fairness. And then ongoing communication and escalation. And how do we do that? So just going to leave with one example of a funny pebble. In the middle of COVID, pre-vaccination, we're taking care of these kids on ECMO with COVID, right? And the ICU has Minions headsets at this time so they can talk to the family. Like we're all wearing cappers, it's a disaster at our hospital. And this 8-month pregnant ICU attending with like a list of grant funding I don't even understand is like, hey, Rebecca, yeah, I have a pebble. I don't know if you've seen our call room, but like the bed is a Murphy bed and there's lots of towels underneath. She's 8 months pregnant. And yesterday I actually fell out of the bed and I hit my head on the desk because the desk is like right there. And I was like, what? And I go in there and sure enough, because you can see how this would happen, people have just taken stacks of blanket and put it under this Murphy bed that has just a broken mechanism. And no one, apparently it's happening for months, no one has said anything about it because, we're just tired in physicians and like, who are you going to complain to? So 64 emails, 60-ish days. Turns out it was under warranty. They had to come, right? We finally fixed the call room and made it a space that you feel welcome and you feel like, oh, somebody actually thought about me. I put the number for housekeeping, so if the bed is not made, you actually know who to call instead of just stacking the blankets on top. And this is what I mean by low-hanging fruit. I don't think making call rooms pretty is the fix to our well-being problem or our systems problem. But I'm just here to say there are things that you can do, and there are systems-level issues we have to change, and there are a lot of national advocacy work that is going on about how we can really change some of the legislation to make our everyday lives easier. But there is some things you can do on your own. So I believe a systems approach is required, and we are the agents of change. But look around you, I bet you've seen some low-hanging fruit. And I'll leave you with this Thomas Schwenk quote, which sort of changed physician well-being movement. Physicians are the proverbial canary in the coal mine. While the canary may be sick, it is the mine that is toxic. Caring for the sick canary is compassionate, but likely futile until there is more fresh air in the mine. So how are we going to let in some air? Thank you.
Our next speaker is Dr. Emily Park. She is a board-certified anesthesiologist and a pediatric anesthesiologist. She's trained in medical acupuncture and is certified in functional medicine. She finished her anesthesia residency at the Cleveland Clinic and then went on to do a pediatric anesthesia fellowship and a cardiac anesthesia fellowship at the Children's Hospital of Philadelphia, where she served as chief fellow. Today, she will be talking to us about the importance of sleep and the impact on health and wellness. Please help me welcome Dr. Emily Park.
Can you guys hear me? Okay, awesome. How's everybody doing? This is the last lecture of the whole thing, right? All right, great. Thanks for being here. So I am one of Dr. Margolis's burnout statistics. You might see by my history, right? I did, regular anesthesia residency and then a peds cardiac anesthesia fellowship. I was doing peds and peds cardiac anesthesia for the first entire part of my career, but burnout definitely got the better of me. Obviously, all of us were in medicine because we want to take really good care of patients, and so you give all of yourself to people and your patients, but there's not much left, for you at the end of the day. If you're taking care of sick, dying kids, 80 plus hours a week, and you don't feel like the lecture she just gave, I literally was nodding my head the whole time. I'm like, yep, that's why I left. Yep, not support. Like all check. But it worked out in my favor, and I'm super happy with what I'm doing now. I'm doing something completely different. I have a wellness practice now, so similar goals to what you wanted to achieve as well. Okay. So she did a great job introducing me. I did, as I mentioned, experience burnout, and I cut my anesthesia hours in order to pursue a wellness career. So I got trained in medical acupuncture and then certified in functional medicine with the Institute for Functional Medicine, which actually since 2014 has an affiliation with the Cleveland Clinic. The Cleveland Clinic has a very large center for functional medicine since then, and they're there studying the functional medicine approach compared to traditional healthcare approaches as far as healthcare costs and outcomes. So it's big stuff. So what am I going to talk to you guys about today? Sleep. This is something as anesthesiologists that we could all use more of, especially in our younger careers when we're all taking call, right? We're forced to have some kind of irregular sleep hours. But what we want to do is when we can control our sleep schedule and our sleep hygiene, we want to do that very best we can. And I'm going to be talking about all the things that you can do to help maximize that in your life, and also if you're not doing it, what are some of the health consequences that can happen if you're not getting enough good quality sleep. So what is this functional medicine thing? So as you can see, there's the 5 Ps that are there. It's personalized, it's participatory, it's predictive, it's preventative, and it's proactive. So what does all that mean? It means so the word personalized really is probably it's at the top of the list on purpose, because there's not a bunch of, there are certain things that we recommend per condition, let's say, but I might have 10 patients, let's say, with hypertension, and there may be 10 different reasons why that person is hypertensive. So we know in traditional medicine, you have high blood pressure, you go to the primary care doctor, they're like, okay, Susie Q, here's your prescription for your beta blocker, your ACE inhibitor, et cetera, right? But there's just not time, the system's not set up in order for that doctor to learn about what are the root causes of your hypertension, right? It's not just that you're genetically unlucky. Maybe that person has undiagnosed sleep apnea, for example, right? Or they have another different type of sleep disorder. Maybe, it has to do with their diet. Maybe it has to do with their lack of exercise, or maybe even more simple things like they're, significantly magnesium deficient, and so on and so forth. So in my type of medicine, we always talk about what are the root causes. We want to find and treat the root causes of whatever signs and symptoms are going on. I also like to say that functional medicine is a team sport. So this is not you go to the doctor with a symptom and you're take this medication, go home, see you later. It's more of, okay, well, let's talk about how you got there to begin with. We talk about your whole life history, literally from the time you were born until the time you were sitting in front of me. We will obviously talk about your entire medical history, medications, allergies, all the typical things you get in a traditional medicine visit, but then we also take a deeper dive into all the lifestyle factors that really create about 80% of health. So let that part sink in for a second. 80% of your health is created by your lifestyle factors: nutrition, sleep, exercise and movement, stress management, toxin reduction, right? So that's one of the reasons why I'm here going to be talking about sleep with you guys. So I already mentioned kind of what functional medicine is. We're all about finding and treating those root causes of whatever signs and symptoms are going on. It's very patient-centered instead of disease-centered. So the example I gave for hypertension, instead of saying, oh, this is a hypertensive patient, the protocol says we give this, see you later. It's like, well, let's talk about what are all the factors that are adding up to this person having hypertension. And by the way, it's very common for there not just to be one reason, but multiple reasons. And working on them all is going to really create health, right? So I mentioned already, obviously, it's very personalized versus protocolized, and we really take a lot of time. So a new patient visit in my practice, it's 90 minutes long, and that's face-to-face time. That does not include the time spent preparing for the visit, looking at all the wonderful forms I've asked you to fill out ahead of time. So I've already mentioned these as the foundations to health. I said 80% of our health is created by these. The other, in functional medicine, the other about 20% or so is what's going on in your own body's biochemistry. So that's where functional medicine comes in. We really are the detectives. We do advanced laboratory testing more so than your traditional primary care doctor would do with traditional labs, and we're also taught in our education process and certification process to dive deeper into different body systems and the testing that's there. So what are the things that we need for optimal health? And some of this may be intuitive, right? Like, obviously, you know we need to eat well. We'll talk about what that is in a moment. We need clean water. We need clean air. These are basic things, right? I shouldn't have to say these out loud, but if you really stop to think about it for 1 second, what are you eating? Are you eating things that are going to create health? Like, I think we all know if we eat a lot of processed and packaged food items, high sugar, high alcohol, et cetera, is that going to create health for you? Is that going to cause symptoms and disease? Yep, it sure is, right? So good quality food, good quality water, clean air. We need enough movement. So this is where exercise and movement come into play, and they are separate. So you all know that 10,000 steps a day goal that gets kind of thrown out there. That was supposedly studied, but I think if you really dive into the research, it's kind of questionable. Some of the more recent studies have kind of shown that is even as much as 4,000 steps a day is a game changer as far as cardiovascular outcomes and just overall morbidity and mortality. The studies also are very clear, the more steps per day you get, the better. Now, this does not have to necessarily be steps per day, right? Because you can, what if you have a knee injury, you can't walk? That's okay, you can do other things that count, right? You can swim, you might be able to bike ride on a recumbent bike, for example. You might be able to do rowing, yoga, tai chi, qigong, other forms of movement. And then there's exercise, which is more about getting the heart rate up into that moderate zone. And the studies are really clear that doing about 150 minutes per week, so 150 minutes per week of moderate intensity exercise is the game changer for morbidity and mortality. The other things we need to work on are, of course, our daily relaxation and stress management. So this is finding just a couple minutes, just a smidge of time for yourself to make sure that you are taken care of. So this is, not only the self-care, but even just finding 5 or 10 minutes in between. I'm sure we've all experienced this, right? Like you're on a schedule, like go, the next case is waiting. But if you just even took a couple minutes to just sit in silence for 1 or 2 minutes and just take some deep breaths, won't you feel so much better going into that next case? You probably will. So it doesn't have to be a big grand gesture of an hour meditation per day. Wouldn't that be lovely if we all had time to do that, right? And it is very health changing if we do have time for it. And then of course we want to have good, meaningful relationships. And so this is the sense of community, social interactions. All of that really, really matters for health. And there's some really great medical studies that show that. There was one that stands out in my mind about cancer patients. Post-cancer, they all had gone, it was melanoma patients to be specific, they had all gone into remission, and then they split them into 2 groups. One had a social support group and the other just was the control. And what do you think happened, right? The group that had the social support had less recurrences of cancer. So this is big stuff. This is not just little side things that we think, oh yeah, I'll get to it, or I can blow that off. They really are game changing for your health. And then of course, getting enough good quality sleep, which is the main focus of our lecture today, right? So thank you for listening to the backstory, and the reason why we are gonna really care about sleep is really crucial for our health. It is one of the foundations. So we are all told to get your 8 hours of sleep, right? So on average, most of us do well getting between 7 and 9 hours of sleep. And do you wanna change that?
They're having a hard time hearing you.
Oh, okay, perfect.
Either this one or that one.
Okay, I'd like to walk. Can you guys hear me? Whoa, hello, can you hear me? I do like to walk, but I was afraid to walk away from that. Okay, so we're all told to get our typical 8 hours of sleep, but there are a few people that do well with less than 8 hours of sleep. We all know that person. They can get away with like 6 or 6.5, but in general, it's really more around 8-ish or so hours, right? Let's talk about what happens during sleep, and then once you understand that, we can talk about what you can do to build your own really good sleep regimen, because there's some super simple things that are low-hanging fruit that we can all do to improve our quality sleep. So sleep. Obviously, there's the 4 kind of major stages for sleep, and then REM sleep is considered the stage R for REM. So what happens during these stages, right? We're going to get into all of that. We go through several sleep cycles throughout the night. The average sleep cycle is about 90 minutes, but how many times you go through the sleep cycle really matters, because you'll see, obviously we spend the most amount of time in our light sleep, but the amount of time we spend in deep sleep and REM sleep is super, super important. A lot of important things happen during that time. So light sleep. So this is really stage 1 and stage 2. So this is where you might get those like hypnotic jerks as you're kind of falling asleep, or those of us that have pets, you ever watch them sleep, you'll see their little jerks or maybe little doggy barks in there. Obviously, I'm a dog fan. I just had a picture of a dog on my slide. So this is a thing. Happens to us too. And our vital signs start to change, right? Like our respiratory rate will slow down, our heart rate will start to slow down, body temperature drops, sleep begins. So as I mentioned, we spend the majority of our sleep time in this light sleep. So this is 50%-ish or so of our sleep. So stages 3 and 4 are more deep sleep, right? So what happens there? Blood pressure continues to drop. We get blood flow to our muscles. So if we tie that to those of us that exercise on a regular basis, this is where, getting a really good night's sleep, you're going to have less, muscle soreness and better recovery in between workouts. Those kind of things can be really important. This is where repair happens. Growth hormone is released, for example. So if you're, healing from an injury and or just regular, circadian release of hormones happens during this time too. This is where tissue growth and cell repair happens. It's a really important part of the sleep. If you're tracking sleep with an EEG, you will actually see these long, slow brain waves start to happen during deep sleep. This is only about 13 to 23% of our sleep. So 15-20% of our sleep is spent in deep sleep. So it's not a ton. So if anyone here wear a sleep tracker? Yeah, okay, so you can see I don't know how you guys feel when you wear your tracking rings, but for me, if I get more than an hour of deep sleep, if I get an hour and a half or 2 hours of deep sleep, whew, I am super woman that day, right? Y'all know you can feel the difference if you track your sleep. So the name of the game becomes how do you get more of that, right? How do you get it on a consistent basis? So REM sleep, stage R. What happens there? So during REM sleep, this is where vital signs change for, the increases. Heart rate increases, respiratory rate increases, temperature regulation is kind of switched off. So instead of having that lower body temperature like you did earlier, it's more kind of neutral. This is where your brain activity is high. This is where you get those super vivid dreams. And then you basically during this time of sleep, you're kind of paralyzed, and that's to prevent you from kind of acting out your dreams. So that's why obviously there are some sleep disorders, sleepwalking and other more significant sleep disorders in which the body doesn't become immobilized, and that's how this happens. It happens actually during REM sleep. But this is about 20 to 25% of your sleep. I'm sure we've all experienced being woken up abruptly in the middle of a dream. How do you feel the rest of that day? Not that good, right? Yeah. So what are the health effects of poor quality sleep? There's a lot of them, and some of them you are maybe obvious, and others of them you might not really know. So the top of the list is the increased risk for cardiovascular disease. So this is hypertension and cardiac arrhythmias. And this is not necessarily even to the level of sleep apnea. This is just poor quality sleep, right? So that's not getting enough sleep overall or not getting enough of the different types of stages of sleep, right? Increased risk for diabetes, so blood sugar dysregulation, increased risk for some types of cancers, increased risk for mood disorders and cognitive decline, increased risk of injury and death from accidents, and it also disrupts all of our hormones, adrenal, thyroid, sex hormones, and hunger hormones. So the hunger thing is real, right? Y'all know post-call, what do you want to eat? You want to eat a bunch of carbs? We all do. We all want to eat more. And there's actually a really good research study to support that. Even just one poor quality night's sleep reported over 300 calorie increase in food consumption without us even thinking about it. So if you're not someone that tracks and monitors your food, you'll just eat more, and then what's going to happen? Weight gain, all these other things can start to happen just from getting poor quality sleep. But for us as anesthesiologists, right, the really big thing to focus on for us is the cognitive decline. Let's say we all know what it feels like to be sleep deprived and doing a case, and you're drawing something up and you're like, what was that dose again? Like, what's the concentration? You feel like you do get impaired, right? So if you start to deprive yourself of enough good quality sleep over time, you start to get these cognitive changes happening more in your daily life. So sleep apnea, obviously as anesthesiologists, this is something we're screening for in our patients, right? It's a huge part of the preoperative scan. You definitely want to know if that your patient has sleep apnea. Do they snore? Are they at risk for sleep apnea? Of course, you're grading their airway and so on, right? But we need to consider this for ourselves and for our partners, because if you have a partner that has sleep apnea, what do you think your sleep quality is? Not good. Right? You're constantly waking up to them snoring, you're having to kick them or move them or whatever the case may be, it disturbs your own sleep as well. So if you or your partner or friend, family, whoever you know and love is having loud snoring, obviously that's like step one, right? But uneven breathing, we know the periods of silence, meaning silence means what? No airflow, right? So you kind of want someone to be snoring at least a little bit. That means some airflow is occurring, but you can still have significant hypopneas during that time that require treatment with a CPAP device, right? So it's entirely possible to have significant sleep disordered breathing without true apneas occurring. But what happens what are the symptoms of sleep apnea? So what happens if you have it? It's a very similar list to what I just mentioned with not getting enough good quality sleep, because when you have sleep apnea, you are not getting enough good quality sleep at all, right? So some of the typical other things, though, have to do more specifically with sleep apnea, are including the throat being dry. If you are a mouth breather, typically you'll wake up with a dry mouth. Mouth breathers are kind of more likely to be prone to have sleep apnea and snoring disorders. Morning headaches is another big one. The mood changes, which is common to not getting enough good quality sleep of any kind, not just sleep apnea. Excessive daytime sleepiness. Not feeling rested even after a good night's sleep. That's kind of a big key. Like the people that say, like, I get enough, I'm in bed for 8 hours, I do everything to get a good night's sleep, and I just never wake up feeling refreshed. And then, of course, this is the cognitive changes again, right? Memory loss, difficulty concentrating, even, if you've been recently diagnosed with ADHD kind of out of the blue without a good reason, these are things to think about. I'm a huge screener for sleep apnea in my practice. Any male that has a low or low normal testosterone level, y'all are getting a sleep study before we do any treatment, because I'm right like 90% of the time. Not getting enough good quality sleep is such a huge stress on the body. It will affect all of your hormones. So what are some sleep hygiene basics? How can we get started kind of trying to build our own really good, healthy sleep routine? So it starts way before bed. There's so many things you can do in your regular daily life that will affect how you get sleep later, right? So food is huge. Really easy sleep hygiene tip. The top thing you can do for yourself if you do nothing else as far as food goes, it's avoid eating at least 2 hours before bed, at least. More if you're like someone that takes a longer time to digest, and you want to leave even a bigger lead time if you're having like a pretty big meal, right? So avoid eating at least 2 hours before bed. And of course, alcohol. We know alcohol is a big downer for sleep, right? Might make you, quote, pass out, but what do you think happens to your sleep scores? Anyone ever wear their sleep tracker after having some drinks? Ooh, it's bad. It is not good. Your REM sleep and your deep sleep, they tank out. So avoiding alcohol, especially late in the evening. Sugar is also another huge one. Big, big, big. That's another one. If you wear a sleep tracker, start paying attention to, when you're out, if you have a piece of cake or some kind of large dessert item, what happens to your quality of sleep? That's a big one. And of course, caffeine. Limiting your caffeine intake. I say 2 p.m., but those of us that are more caffeine sensitive need to maybe start earlier in the day. If you are a slow caffeine metabolizer, even extra caffeine in the first half of the day can affect your sleep quality at night. And I'm telling you from my own experience, it's one of those things that you would not know is getting you until you try reducing it or stopping it. I know that's so evil to say to anesthesiologists, right? Stop drinking coffee? No way, right? But it's true. So exercise is also another huge one. While we want to make sure we're getting enough exercise and movement, right, during the day, because that's also something else that can really affect your sleep quality. If you've been pretty sedentary, you may have a harder time falling asleep. So getting some exercise and movement can help, but you also want to avoid that exercise and movement about 2 hours before bed. So 2 hours before bed, treat that as like it's sacred. You really shouldn't be eating a lot, you shouldn't be moving a lot, you should be relaxing and winding down. So another huge thing that's easy to do is changing your light exposure right before bed. So ideally, no bright lights or screens 1 to 2 hours before bed. If you're super sensitive, the 2-hour rule applies to you. If you're not super sensitive, you can get away with about 1 hour. But in the evening time, just kind of think of this logically. When the sun goes down in your house, you want to try to dim things, right? You want to try to get ready for, have a relaxing evening, create a good, relaxing sleep environment for everyone in the house. Instead of having these huge bright lights on right to the very end and then expecting our brains to go, oh, okay, it's bedtime now. So that's something we can do to help ourselves out. Now, if that's not reasonable, possible, or doable for any reason, what you can do to help, it's helpful, but it doesn't take away the light exposure, is to get some blue blocking light glasses. So these are, anybody remember the blue blockers, those commercials? Oh my gosh, right? They're so crazy. They're huge. They took up half your face. They might have much cuter and smaller ones now, but that's literally what it is. So they're orange kind of tinted glasses, and they block out the blue light. So if you have to be working on a screen late, or it's wind down time, and it's the only time you have to spend with your spouse, and you guys want to watch a show, turn the lights down, put your blue blocking light glasses on. Definitely will help with sleep. Now, light is also important for another reason. We want to not only avoid bright light at night close to bed, we want to get nice, bright, natural light exposure first thing in the morning if we can. Now this is also kind of hard for us anesthesiologists, right? Especially depending on where you live and the time of year it is. Sometimes you go to work and it's dark and you come home and it's dark. I mean, I experienced that many, many times, right? I mean, I did residency in Cleveland, right? Happened a lot. And so what you can do is you can actually get a light box. You get like a 10,000 lux or greater light box and just kind of expose yourself to it while you're getting ready or eating breakfast or drinking your coffee in the morning, so you can get your light exposure that way. Natural sunlight is of course the best, right? Then we want to make sure we're going to bed and waking up around the same time as many nights as possible. And I hesitate because obviously you're anesthesiologist, right? So you're on call. You can't control what happens to you on call. But the rest of the time, you really do want to try to be consistent. Our bodies like the rhythmicity of a normal, regular wake time and sleep time, right? So you want to try to be as regular with that as possible. Obviously, life's going to happen. Also, you're going to have events or things that are going to upset that, but the goal is to control it on a regular basis, right? So if you can get to sleep on the earlier side, that's also pretty important. The sooner before midnight you can get to sleep, the more deep sleep you're likely to get, right? So the studies are pretty clear on that. So if you push your bedtime later, your chances of getting enough sleep cycles, right? Remember I said the sleep cycles are all about 90 minutes, it diminishes. Okay, so what else can you do for sleep? Stress reduction is huge. So this is where maintaining a little bit of time for yourself, as I mentioned earlier, a daily meditation practice would be amazing, but it does not have to be meditation, right? It could be deep breathing, it could be prayer. Time outside in nature is also huge and a really big needle mover for health in general. Reading, journaling, coloring, art, personal care time, just taking care of yourself. Maybe, making time for yourself to go get a massage or a facial or, get your nails done or whatever makes you feel relaxed is really important. And then these bottom ones here, are so important. They're crucial, right? Appreciation, gratefulness, kindness, effective communication. These are all really, really big. And then some of the things that Dr. Margolis was talking about, like kind of in the OR work environment that can make a huge difference, as well as maintaining the strong social connections. So my favorite resources, because I get asked this a lot for meditation, because meditation can seem so daunting, or I think a lot of people think, oh my gosh, I'm never going to learn how to meditate, or I tried it and I can't get my brain to shut down. That's a comment I hear from patients all the time. It would be great if you could just drop right into a deep meditation the first time you tried it, but just like every other skill in life, when does that happen? Did you get on a bike the first time and ride without training wheels down the street? No. Did you nail your first 10 intubations without any help? Probably not. It's just logical that this is a skill that you're going to have to put a little bit of effort into to get good results. So meditation is no different from that. It's also a big myth that you have to drop into this complete deep, no thoughts occurring in your head in order to get the benefit. So you'll see, the more stressed you are, the longer it will take to quiet the mind, or to make, I call it the squirrel brain, make your squirrel brain less active, but you're still getting the benefit by doing it. So there's several really good resources for you to learn. So there's some apps that I love that are, a lot of them are free or have free trials. Calm has been around for a very, very long time, so has Headspace. BrainTap is great. I'll talk a little bit more about that in a second. And then Meditation Experience. Those are my top 4. BrainTap is extra special to me personally because they actually have an entire list of specific sleep meditations. And you do have to listen to it with headphones of some kind because it has these extra special binaural beats, holosyncratic tones, and isochronic music. So it has 3 different sounds that come out that actually change your EEG. They change your brain waves, right? So BrainTap, I personally listen to it. I fall asleep to it every single night. It's wonderful. I get a set of headphones they're called sleep phones actually, it's a headband, so the headphones are inside the headband, so if you fall asleep and turn your head, you don't wake up with the crunch of your AirPod in your ear or something. So you can make it happen, but BrainTap, definitely my favorite. Now, if you want to learn how to meditate without anything, without an app, without special anything, the online meditation course by Emily Fletcher, it's called Ziva Meditation, is phenomenal. It's a short 15-day course. Takes about 20 minutes of your time, 15 days in a row. And by the end of the 15 days, it's literally like a magic trick. She will have you meditating 15 to 20 minutes a day, twice a day, actually, and you won't feel like you've added any time to your schedule, right? So why is that? I could go into lots of research studies on the science of meditation, but it does help you be more efficient, better with decision making. There's a large list of health conditions that it's a needle mover for: hypertension, diabetes, pain management, and so on and so forth. So there's so many great reasons to meditate besides reducing stress and improving your sleep quality. Okay, so what are some other ways, other things you can do to help your sleep quality by managing your stress? So acupuncture is awesome. Love it. I obviously trained in it, so I'm a huge fan. But has anyone in here ever had an acupuncture treatment themselves? Oh, nice percentage, guys. Okay, so you know how relaxing it is when you get the needles in. You kind of almost do go into a meditative state most of the time. But acupuncture has a lot of other goodness to it too. The studies are really clear. It also decreases cellular markers for oxidative stress at all levels. So can be really helpful for other reasons too. But of course, other things like body work, massage, infrared sauna, I'm a huge fan of that. You do not want to do a sauna too close to bedtime because what happens to your temperature raises. When you're getting ready to fall asleep, you actually want your core temperature to be a little bit lower, which we'll talk about in a moment. But other things you can do, yoga, tai chi, qigong, of course, therapy and counseling if you have a significant stressor in your life, especially if there's a life-changing event going on, getting some counseling and therapy, or if that's not possible, even just, talking to a peer or, friend or family member about what's going on, getting it off your chest, getting it out of your brain, talking it through can be really, really helpful. And if you want to take that to the next level, neurobiofeedback is phenomenal for that, not just stress and sleep, but for many, many other conditions. So what do you do to optimize your sleep environment? So we talked about all the things you can do in life to help you get better sleep, but when it comes down to making it happen. So the biggest thing you can do is control the temperature in your room. So getting it as cool as possible. The studies are kind of showing between 68 and 74 degrees is the right temperature. If any of us that live in Arizona, getting your AC to consistently go below, much below 70 is pretty hard on it, right? It can be tough at certain times of the year, but it does make a big difference. Now, if you are unable to cool your room, or let's say your sleeping partner, they freeze, and so they want all the covers, but you're hot, and you you have differences in sleep temperature preferences, you can actually get something that goes on your mattress pad that allows you individually to control the temperature. And I actually have an 8 Sleep, huge fan, because the scenario I described is my husband and I want it cooler and he freezes. So you can set the temperature. It actually also tracks your sleep. And remember how I was talking about the different sleep stages and what happens with temperature regulation? It picks up and knows when you're in REM versus deep sleep and will adjust the temperature slightly based on that. Love it, big fan, big fan. Other things you want to do besides temperature, obviously you want to control light exposure. So you want to make sure the room is as dark as possible. If that means you need darkening blinds, shades. If it means you put a sleep mask on yourself, I'm a huge fan of that, by the way. That can be really, really helpful. That's huge. And if at all possible, you want to try to block out all those little annoying electronic lights that are there. You probably notice that a lot when you're in a hotel room, right? So they actually make removable little stickers that you can put over devices to quell those, make it less disruptive to your sleep. And then of course, quiet, right? So if you want to really block out the noise, you want to get some really good earplugs. That can be super helpful. And earplugs, if you've ever worn them to bed, you can still hear. So if a big crash or something happened, or a kid needed your attention, or a dog barking, you can hear that. But what you stop hearing are the smaller, low-level noises that wake you up more frequently if you're a light sleeper. Earplugs are great if you have a snoring person in your house. Really help you out. And then, of course, as I've talked about already, tracking sleep. One of my favorite devices to track sleep is the Oura Ring. Does anyone have an Oura Ring specifically in here? No? Okay, love this thing. I wore a Fitbit for tracking for a long time, and when I got my Oura Ring, I did a split study. I wore both for a couple weeks, and I can tell you firsthand the Oura Ring is way more accurate than your Fitbit as far as everything, because it tracks the stages of sleep, I feel, a lot more accurately. It also gives you, to me, a more accurate resting heart rate, and it tracks HRV, heart rate variability. Do anyone know what HRV is, the concept of heart rate variability? It's basically a measure of your sympathetic versus parasympathetic nervous system activation. The lower your heart rate variability is, the more stressed your body is. So the Oura Ring also reports that really accurately. And if you think the ring, if you think about the technology it essentially uses pulse ox technology to get all the data. And it actually does, the latest and greatest version of it actually does give you pulse oximetry readings, and it will report, was your breathing regular or not? It tells me your SAT was 99% last night. No irregular breathing patterns were detected. The technology is really great. So if you're having sleep troubles, and I find the Oura Ring's really helpful for feedback also, because some of the things we were talking about earlier with, sugar or late light exposure, alcohol, stress, all of that, you start to become aware of, hey, this did that to my sleep. Okay, let's do less of that. It's just really good feedback. And then, of course, you want to obviously give yourself the opportunity to have at least 8 hours of sleep. That sounds super simple and ridiculous, but it's actually really important, and it's underrated. I think a lot of us get busy, and we just go, and then we're like, I don't really need that extra half hour of sleep, but then it really starts to creep into your life and affect so many other things and will poorly affect your health. So bedtime routine, when you're getting ready for bed, you want to create a relaxing environment. So you want to do something relaxing for yourself. If you have time to do a self-care regimen, like an Epsom salt bath, or even just putting lotion on or dry brushing, something super fast and simple that you can do before bed, you want to try and do something to shut your brain down, whether that's reading a book or relaxing, listening to some relaxing music, or doing a sleep-specific meditation like I was just mentioning with Brain Tap. And when I say read a book, by the way, I mean not the kind on a screen, right? I actually have an old school, I carry old school paperback books with a reading light that has like an orange tint to it, so my eyes are not exposed to bright light. You can probably tell I'm one of those people that I have to have all the things in order to get a good night's sleep. That was a gift from burnout from anesthesia days. I started not sleeping very well, and it kind of stuck with me. But it's really, really well controlled if I do everything that I just talked about in this lecture. Okay, so just to bring it back to foundations to your health, remember 80% of your health comes from these things: nutrition, sleep, exercise and movement, stress management, toxin reduction. Thank you.
Thank you for this wonderful lecture, Dr. Park. Thank you so much. We have some time for questions. I realize we went a little over, so anyone has any questions at this point for Dr. Park or Dr. Margulis? If not, I actually would like to I have a question for both of you. Dr. Park, thank you again. This was a very, very comprehensive lecture and very well needed. I'm definitely somebody who doesn't get 8 hours of sleep, so I'm always sleep deprived. But do you have any tips for moms? As mothers, I think it's a lot harder to be able to prepare for sleep. And so that makes it a little bit more difficult for them to get their 8 hours of sleep. I'm not a mom, so I can do a lot of those things, but any tips for moms to help them out as far as sleep?
Yeah, so it does become challenging, right? Because you run into this, kids go to bed, and then you have a list of things you have to do, right? Like the dishes and the cleanup and the prepare for lunches and like all this stuff you have to do, right? So it's like, how do you fit it all in? There's no like super magical answer to it. Just better, more time management, and then even getting your partner on board. If you are married, you do have someone in the house with spouse or whoever, a family member that can help with those. Delegation of some of those tasks might be really helpful. But I like to have people make a hard stop. So it's like, okay, I'm going to bed at 11:30, let's say right now, because I have all these things to do. Well, telling you to go to bed at 9 p.m. tomorrow night is not going to happen, right? It's just not realistic. But saying, hey, you know what? Why don't you try making 11:15 your hard stop, and then just kind of work on that for a week or two, and then 11 o'clock your hard stop, and kind of work on that. There's really no, super magical answer, because it's life, right? Like certain things have to happen, and especially if you are a working mom, you can't shift those things to during your work hours. So there's only so much time in the day. But things like food prep on the weekends, there's some little things you can do to help with that on a daily basis.
Thank you so much. Dr. Margulis?
I just ordered the silicone earplugs. Thank you. That was, yeah.
You're welcome.
Any comments?
Oh, no,
Okay.
I think it's a challenge for all of us with shift work, and our eating habits at work are hard. I was hearing about private practice and no breaks, and
That's why I burnt out.
Yeah. Anyway,
I had a question for you on burnout. Thank you again for this great lecture. You mentioned a lot of drivers of burnout, but I'm a critical care physician, and I always see critical care ranked as the number one almost in physician burnout. In your opinion, what are the top 3 professions that you feel like are? Do you agree that critical care is? What advice do you have for us? And especially since COVID, it's been really like number one. I mean, I experienced it, and I think it really demoralized a lot of ICU physicians. Can you comment on that, please?
Yeah, there's great data on this. Tate Shanafelt and others have actually surveyed physicians about every 3 years, and I would have to actually look, but I believe it's critical care, anesthesiology, internal medicine are usually the top 3, and we all kind of wrestle for the top position. We are always number 1 in suicide. I think COVID, it's no surprise, right? Pediatric critical care medicine's having the same problems right now. I think the moral injury that specifically physicians, but really specifically critical care physicians during COVID had to deal with, and the moral quandaries of what resources do I use on my unvaccinated patients who made that choice that are now taking it. I mean, it was just really hard, really, really hard. So those are the usual 3 groups, but even if you look at the bottom healthy groups, dermatology, it's still like 40%. It's not good.
Yes, you're right. And, I think, again, your lectures, both of yours, would be helpful for us to, think about, things to think about, and hopefully things to tell our chairmen as to how to decrease burnout in the workplace and improve work environment. Dr. Griffin, go ahead.
Great presentations. Just wanted to talk as a coffee drinker. I'm not very sensitive to coffee.
Guilty.
Yes. But I remember back in med school days, I would be studying, going on these study marathons and drinking a 20-ounce coffee and then just being so tired, laying my head down, and then just vivid dreams and 15 minutes of this twilight, whatever, and then waking up fully restored. So I'm just curious, what do you think is going on during that? Is that REM sleep or non-REM?
Yeah,
or what?
yeah, you're getting the power nap in. So the studies on napping, if you do it regularly and you keep it to, there's debate on 30 or 40 minutes, somewhere in there is kind of like the sweet spot. Much more than that, you're not likely, you're more likely to wake up feeling groggy, and then it will affect your sleep that night, and then you'll end up in this vicious cycle that you slept poorly, you feel tired, you need to take a long nap, and so on. You just rinse and repeat. Caffeine, if you are a fast caffeine metabolizer, we all know those people that can have a cappuccino or 2 at dinner. It's 10 p.m. and then they're like, oh, I'm gonna go to sleep now. Like, I would be I would never fall asleep. So it actually has to do with our CYP450 genetics, which there's a SNP for caffeine metabolism. So it just depends on how you went with that. But yeah, the power nap can be really helpful. So that's probably what you were experiencing during that time. Yeah, that's REM sleep. Yeah, so you were so exhausted that you kind of skipped over the light sleep and the deep sleep and got like a chunk of REM sleep. That can happen as well. Yeah.
Thank you so much. If we don't have any more questions, I would like to close this session. And please help me again welcome and thank Dr. Park and Dr. Margolis for an amazing work.